Superbugs are rare strains of bacteria that are commonly resistant to antibiotics. These superbugs often lead to life-threatening infections that scare doctors and patients since there often isn't a known cure. There are a growing number of Americans contracting infections resistant to most antibiotic treatment from international travel, some of them after receiving medical treatment in other countries. Recently, nearly a dozen Americans who had medical procedures in Tijuana, Mexico, have returned home with dangerous antibiotic-resistant infections. The infected medical tourists came from 7 states. 8 of the individuals underwent weight loss surgery at Grandview Hospital in Tijuana. The remainder had weight loss surgery at other Tijuana surgery centers. Most of the patients were women in their 30s and 40s and had surgeries between August and December 2018. State health officials say these patients may be at risk for blood-borne diseases such as HIV, hepatitis B, and hepatitis C. Officials are urging clinicians to take travel histories for patients who had medical procedures abroad. The more antibiotics are used, the less effective they become. This has led to the rise of multi-drug resistant superbugs. Certain strains of tuberculosis and MRSA are known superbugs. People can carry these highly resistant pathogens in their bodies and not become infected, but the germs can spread to others, especially in hospitals and healthcare settings if people don't properly wash their hands, surfaces, or medical equipment. In 2014, 5 New York residents contracted Q fever after getting injections of fetal sheep cells in Germany for treatment of various disorders. The potentially flu-like illness was caused by a bacteria found in goats, sheep, and cows. Eventually, these superbugs will evolve to defeat every antibiotic on pharmacy shelves, and new drugs will be needed to fight infections. To combat superbugs, researchers advise eliminating inappropriate use of certain life-saving drugs in both humans and animals. They also call for the reduced need for antibiotics by using alternative and non-traditional approaches to disease treatment and prevention. Right now, the Centers for Disease Control and Prevention are investigating additional cases of this latest superbug linked to Tijuana.